This week on Jersey Matters, the Delta variant is sending children to the hospital. We talk with Dr. Martin Topiel, the head of infectious diseases at VirtualHealth. A New Jersey veteran wounded in the war in Afghanistan says the withdrawal from Afghanistan is embarrassing. And the great mask debate. What is going to happen when schools open this fall? And an expert encourages us all to squish a spotted lanternfly on site. Hello and welcome to Jersey Matters. I'm Larry Menti. The Delta variant, the highly infectious strain of COVID-19, is causing a rise in cases and hospitalizations around the country and in New Jersey. What is especially concerning is the rise in cases in children. For more on the Delta variant and children, we talk to Dr. Martin Topiel, infectious disease specialist at VirtualHealth. Hi, doctor. Thank you so much for doing this. Children and COVID-19 are making headlines across the country. Let's start off by getting some of the numbers or some of the statistics or the threat of COVID-19 for children. What are we seeing?
Well, we're still accumulating numbers. We're certainly seeing different geographic pockets in the country. Some have more prevalence than others. So we know in the South and areas in Florida, Louisiana, they've had a much larger amount of cases. But yet in San Francisco, there have been virtually no admissions there, and that's been reported recently. So it's unclear why these geographic variations are going on. What we can say is prior to this summer, there have been 340 deaths in children. So even though people have made it out to be that this wasn't really a problem for children, it has been. And certainly when it's your individual family child, that one person is all that means to you. So pediatric illness is a big thing. We weren't prepared for this. We didn't know it existed. And we certainly have tremendous concerns with the school year coming up.
Yeah, I looked at some of the numbers and I understand why you didn't give them because it is a moving target. But at one point, I think it was around August 1st, they were saying that 84,000 children had gotten the Delta variant and it was up almost 80% from the week before. And so I haven't followed it from there, but you can imagine that the Delta variant among children is spreading rather quickly. The question is, what do we do about it?
Right. And to go back to that also, we know that there's concerns about multi-inflammatory syndrome in children. We also have concerns about the implications of the long haulers. Particularly in kids, what are the long-term effects of even mild illness? And that's something we don't have available to us. What do we do about it? I think the CDC has come out with appropriate recommendations. We have a vulnerable population below the age of 12. They're not vaccinated at all. Above the age of 12, we're certainly nowhere near a large immune population. So I think the CDC has put out appropriate recommendations that there be masking in the schools among teachers, students, people who go inside. And while we may be thinking about that in terms of the children, let's remember the children come home to their grandparents, their grandmother, their immunocompromised parents. Everybody's at risk with that. It's not.
It can still be asymptomatic, right? That's right. Happening.
Right. What's so bothersome about the Delta variant is transmission can occur both in unvaccinated and the vaccinated when asymptomatic. The transmission still happens. And so that's why masking is so important. And it's important indoors in the school, and it's important indoors in stores and retail areas so that we block that transmission. We don't have a magic wand as to who's infected and who's not.
Where are we now with the vaccine for children between the ages of 5 and 12? I know Pfizer came out and said that they were ready, but I guess it's not getting FDA approval for a while, and that's getting pushed back and back and back.
Yeah, it's so difficult. And I think they're still expanding the size of the study between 5 and 12. So they're not ready yet to present that. The word I hear is that maybe in 3 months that may appear, but they want to accumulate some numbers yet.
So it's not going to be ready for September. It's not going to be ready for the beginning of the school.
It's not going to be ready for September. And I think what we have to do as a collective population is build that safety bubble so that our schools, our teachers, our population is safe. And I think what we have to do is promote vaccination to children, sort of get rid of that idea that all the children are safe and nothing happens to them. We need to protect them, and we need to protect their families.
So when it comes to the vaccine, do you think it should be mandatory for children?
Yeah. Well,
when it's available?
That's, of course, that's a very tough question. I would love to see it, if it's mandatory for children, it has to be mandatory for adults. So I think it's hard to say it's mandatory or all-encompassing children. We can build that bubble without it. We really need to promote the hell out of it. We really need to show the safety figures. This is the safest vaccine that's ever been produced. We've never had anything that's been able to show a safety profile like this vaccine has with such high numbers.
The reason I separated children and adults was because there are already vaccines that are mandatory for children to go to school because it's a public school, it's a government building, and the health of the other children are at risk. Businesses can do the same thing. They're allowed to make vaccines mandatory. So with that caveat, with the fact that they already require vaccines, I ask you the question again: would it be wise for that to be among the vaccines that are mandatory for schools?
I would love to see the safety profile before stepping out in front of that one. We don't have anything published yet. For the 12 to 18 group, it may be that we're near that. I go back to thinking about smallpox, polio, the MMR vaccines. Yes, all those were mandated for attending school. We even have mandatory meningitis vaccines for our college youth. So it's really something to push forward about. I doubt we're going to be able to mandate that if we can't get across the finish line on the adults, though.
Right. Yeah. There's already some universities that are mandating the vaccines. I believe Rutgers is at this point. If you not vaccinated, you have to go virtual. Do you see a point where we might have to go virtual again?
I think there's a decent possibility of that. The school is going to be a very disruptive situation. Let's remember, last year, there was very little school attendance. If we don't have good masking with this Delta variant, with the transmission capabilities, it's going to be a very disruptive situation. And there's going to have to probably be a fallback plan in order to have remote capabilities. I find it hard to believe that we'll be able to do a school year 100%. And that's knowing just Delta. We don't know what might be coming down the pike otherwise. So we really need to have all sorts of preparations for that.
Sir, thank you so much for your time. It was valuable information. I appreciate it.
Thank you.
Dr. Martin Topiel, Infectious Disease Specialist at VirtuaHealth. Still to come on Jersey Matters, a New Jersey veteran who was wounded in Afghanistan reacts to the chaos he's watching on TV as we withdraw from that country. That's next.